So I'm here with George Worthington from Eurofins, and what we're going to talk a little bit about is what actually happens to your sample when it comes to the lab. So George, tell us a little bit about when you receive samples, what happens from now on in?
Okay, so all the Bluecrest samples that arrive in come with a QR code already on the form and on the sample. We use that QR code to upload all the information from the patient's name, demographics, and specifically the tests that are being requested. That allows us to ensure that there's no risk of manual input error. So all the information that we receive is the information that has come to us from Bluecrest. This gives us a very high quality booking in process, so we know that the samples are matched to exactly the patient and then the tests that are required. When the samples are received into the laboratory, the team in the laboratory will check that the demographics on the tube match that on the form and match that on the request that comes through. That way we can guarantee that the results we're giving out are matched to that patient the sample was taken from initially. That sample is then, through our IT system, is given an individual barcode number. We then use that barcode for all the processes within the lab. We no longer use the patient demographics, and that separates the patient from the actual test that's being run through. That barcode is then analysed by all the different instruments we have in the lab, allowing it to pull through the information the test requested against each of those tests. So the correct tests are done on the correct patient using that barcode system.
Great, so there's a really robust mechanism to ensure that no one's mixed up and that processes are very tight. How many sort of samples might you be dealing with on an average day here?
On an average day, we range between 1,000 to 1,500 samples a day, which gives us around 20 to 30,000 tests per day.
And do you process samples just in the private testing arena, or do you test for the NHS as well? What does that look like?
We have quite a wide spread of patients coming into us, so private, NHS, wellness clinics, private clinics. So we cover a large scale of the market, and that can be test specific. So certain clients will send in certain tests through there. But it's not just blood samples we receive. We also receive urine samples, stool samples, saliva samples. We have a wide range of different analytical methods we can use in different sample types.
Great. So you might just as equally be testing samples from the local hospital or the local GP as much as a private clinic, is that right?
Yes, we have actually local clinics very locally to us, and patients who specifically come here to be bled from their GP practice in order to get samples run through us. Excellent.
And one of the questions we quite often get asked at Bluecrest is why are our reference ranges different, maybe different to another lab, for example? Can you help explain what that's about?
Yeah, so all the tests that we can offer come with a reference range that's either dedicated. Some have harmonised pathology reference ranges. So some tests are exactly the same no where they get tested for. So HbA1c, for example. Some of the other tests are instrument specific. So if we have one analyzer, that gives a specific type of reference range, and that comes from the manufacturer. Sometimes they are localised for the population that's here. And that can be, again, test specific as opposed to.
So my understanding is that your analyzers, the equipment you use, might be different to another lab down the road, for example, and so that explains some of the difference in reference ranges that we have to put out there. Is that right?
Exactly right. So each manufacturer of a different instrument will have a different reference range that comes through.